What if the future of spine surgery isn't fusion, but something better? Dr. Jason Cuellar sits down with leading cervical spine surgeon Dr. Armen Khachatryan to discuss how motion-preserving disc replacements are transforming lives. From decades of experience to cutting-edge outpatient procedures, this is where innovation meets real results.
So I'm here with the famous Dr. Armen Khachatryan, and I'm so happy to see my good friend.
Hey Jason, great to see you as well, my friend.
So you've been a big advocate of motion preservation, as have I, and you've been doing it a lot longer than I have.
The first disc that I put in was a Charité disc, which unfortunately is no longer on the market, but then subsequently the Pro Disc lumbar. And then my first cervical was in 2006, so it's been almost 19 years when I call it my first kiss. When it comes to cervical arthroplasty, and ever since then, I've kind of fallen in love with technology. It's been a great 19 years.
How many total disc replacements do you think you've done at this point?
We were counting them up until, I don't know, when we got up to a couple thousand, especially on the cervical side, somewhere in the range of, without exaggerating, 2,500 to 3,000.
I'm constantly seeing patients who come to me as second, third, fourth opinion, and they've been told by all these other surgeons that disc replacement is experimental, disc replacement doesn't work. Can you talk to me about your experience with that?
I basically built my practice on those second and third opinions. So I think to some degree it's a disservice to the patients. Many of them go in and see some of the surgeons and end up trusting what they're saying when clearly that's not true. The data for artificial discs, both in the lumbar spine and the cervical spine, is the best data we have in spine. When we look at randomized prospective studies and how good that data looks compared to fusions, there's no question that's a better option. I really think patients have become more and more savvy. They seek out people like you as well as myself. Literally now, just like you have been, see patients from all over the country. We see them through telehealth. Tell them that they're very good candidates for artificial discs, and then they end up traveling to our center here, and we provide them with a service that is going to be much better for them than fusion. And we both kind of, again, philosophically, in every possible way, we agree on that.
Yeah, well, I'm very impressed by your work. I think you're an amazing surgeon, and you've got such a great practice here in Park City. And I too have patients that come, mostly from the East Coast, but from all over the place, who are looking for a surgeon that is experienced in spine arthroplasty to avoid that fusion. But now, in my practice, I'm doing, I'd say, 90 to 95% disc replacement.
Yeah, same here. It's amazing, isn't it? And when you tell that to some of the surgeons who are kind of dabbling in arthroplasty, they go, that's impossible. I go, well, I'm happy to show you my data. I'm happy to show you literally my OR schedule on any given day, and you see that it's just the fusion is incredibly rare.
And the patients are doing great. It's not like you're having problems,
They're
right?
amazing.
Yeah.
So I just finished doing surgery on 2 patients, one with a 3-level disc replacement in the neck and the other one with 2-level. And they literally are leaving an hour and a half after surgery to go home feeling great with complete relief of their arm symptoms, a little soreness in the neck, but we know that's going to get better. These patients are some of the happiest patients that we have.
Yeah, I know you're also doing a lot of outpatient spine surgery.
Yeah, so it's a combination of having the right setup in terms of the right anesthesia, having the pain protocols in place. I do that in the cervical spine. I don't in the lumbar because I don't have the good fortune of having such an amazing access surgeon like you do. So for the lumbar spine, if you have a really good access surgeon who can get you to the front aspect of your lumbar discs safely and do so through small incisions, and then now with some of the anesthetic methodology that we have with tap blocks and etc., clearly these surgeries can be done safely and they can be done in an outpatient setting. It's something where I think where we're providing higher level of service in an outpatient setting. I really think it's even safer in many ways in terms of avoiding the issues related to hospital infections and etc.
In fact, I proved it with a pretty large research study I did in Los Angeles 4 or 5 years ago, where I took a bunch of surgeons. We took 100 patients that we did all anterior lumbar spine surgery in the hospital, 100 patients we did all anterior lumbar, the same exact surgery in the surgery center. We compared outcomes. We were able to prove that it's completely safe, no major complications, no problems, no hospital readmissions in the surgery center. That's the future as far as spine surgical care. Can you talk a little bit about what you think the future of spine arthroplasty is, particularly cervical? I know that's really your forte, and I think you're working on some of the next generation implants.
What's interesting is that I've been talking about arthroplasty for years and years, right? So I've gone across the country and across the globe really talking about this. And as it relates to arthroplasty in the US, one of my last slides in my presentations would be that by 2025, if a surgeon submits a request for authorization for cervical fusion, the insurance companies are likely going to deny it and say, why aren't you doing disc replacement, right? Because the data was so good and it continues, has remained so good, right? Well, I was wrong. So fusion still appears to be the preferred choice, and it seems like it's much easier to get fusion approved through the insurers. The second part of my prediction was that patients are going to become more and more educated and going to demand disc replacement more frequently, and they're not just going to settle for fusion. Now that part of my prediction I think is coming true. I think, like you mentioned earlier on, many of the patients, when they're told they need surgery, whether it's fusion or whatever it may be, they go home, they try to do a bit of research and try to figure out, is this really what's best for me? And I think people like you and myself have had a very good presence online to try to educate patients that they do have an alternative. So now more and more patients are seeking out that alternative compared to a fusion and finding surgeons like yourself as well as myself to come and see and get that treatment. So I think in that sense, things have evolved, and more community surgeons are doing disc replacements, but they tend to be more of the simpler, easier ones, right? That are like soft disc herniations with not much disc collapse. But in our hands, I've seen the work that you've done, especially in lumbar spine. I mean, you've taken some amazingly degenerated lumbar spines, and I've done the same thing in the cervical space and reconstructed them basically to what is a very functional and pain-free spine.
It's really artwork at this point. It's a real skill, and I'm happy to have surgeons like you that are sort of pushing the field forward. It was really great to chat with you today. I look forward to working with you more.
Hey, great to see you as always, okay? Come back anytime.